Doctors of Reddit, what's the stupidest patient you've ever had? Had a patient come in stating that he couldn't bend his knee. Asked him to remove his trousers so I could examine his leg. After he removed his trousers, the reason that he couldn't bend his knee was that he had a plaster cast around his knee. Checking his notes, he had been sent numerous letters asking him to come in for removal of this plaster cast, and as he hadn't attended any of the outpatient clinics, the hospital had assumed that he had removed the cast himself. Patient thought taking vitamin B6 double dose was the same as B12. Okay, this is by far the best one here. I once had a child who swallowed a sizable magnet that passed to the intestine, and we were just waiting for it to pass in stool. The next day when he came for follow-up, we just found out that he swallowed another one that got stuck to the first magnet in the intestine through the stomach wall, resulting in intestinal obstruction, and he was transferred to or immediately to have them surgically removed. That kid needs to get his crap together. I had a mom and grandma bring their 12-year-old granddaughter to the emergency room because she was bleeding. Not from trauma or a wound, mind you. The poor girl had started menstruating, and the mom didn't want to explain what was happening or started to happen, nor that it would continue to happen, as mom and grandma well knew. On the upside, it was a very quick visit once they were actually seen. Ugh, this is such a shitty thing to do. Firstly, it's completely unnecessary and a waste of medical professionals' time, and secondly because it likely makes the poor girl feel like what's happening to her is abnormal. I had to explain to a 17-year-old girl and to her mother that she was not in fact allergic to alcohol, but she was just hungover. She complained that on nights when she drank too much vodka, usually on an empty stomach, that she would feel nauseous, flushed, and sometimes vomit in the morning. But it didn't happen all the time, and there were no other typical symptoms of an allergic reaction. This one's my favorite so far. It hurts me incredibly though. Irate mom who wanted to speak to the doctor because we took an unauthorized urine pregnancy test on 16-year-old daughter just before x-rays. I never consented and now she's traumatized. Explained that it is standard in females of childbearing age and that consent to treatment was signed upon entrance to facility. Not good enough. They were rich Southeast Asian, and I suspected that this routine standard was perceived as an insult to their status. I worked at a pain management clinic. In an attempt to combat opioid use addiction abuse, a lot of patients were prescribed a medicated cream. It looked a lot like sunscreen, and you just rubbed it onto the hurting areas. I watched the nurse carefully and slowly explain how to rub it onto the skin, using small, uncomplicated words and going through the motions of applying it several times. But every so often, patients would complain that their cream tastes bad. Paramedic. Got a call for a stroke. Patient had facial droop and slurred speech. Says that it feels just like the last time she had a stroke, 10 years ago. Says that the symptoms came on about 4 days ago and she knew the moment it was happening that it was a stroke, but didn't go to the hospital because she thought she could make it go away on her own. Me. Any chance you're pregnant? PT. Number. Me. Are you sexually active? PT. Yes. Me. Why is there no chance you're pregnant? PT. Because I'm not married. Me. Pee in this cup. I'm not active. I just lay there. My dad is an orthopedic surgeon who does a lot of hips and knees and cries with laughter every time he tells the story of a woman who didn't understand how hip surgery works and thought they were going to take her leg off, fix the hip, and then reattach her leg. I blame Barbie dolls. A guy came to the outpatient clinic with swollen left ball. He said he was injected with some Kajupa oil by his friend, with his consent, to enhance his performance in bed. I'm a female medical intern and I tried so hard to keep my expression as neutral as possible. He's got some big balls. There was a 24-year-old patient who was brought in from a jail in a rural county. He was working roadside cleanup when he found a bottle in a ditch that he thought contained alcohol and he quickly chugged it down. To be fair, it did look like whiskey. It wasn't. It turns out it was a substance that contained sulfuric acid. Its pH was less than 2.5. It just ate up the litmus paper. So shortly after he gets to the ICU, he is in excruciating pain and vomiting blood. The gastroenterologist took him to do an EGD, basically a procedure where they can look at the esophagus, stomach and duodenum with a camera attached to a flexible tube, and the pictures were horrendous. You could literally see his stomach and esophageal mucosa eroding away. He had to be sent off to another hospital where they had an esophageal surgeon who could repair the mess. He of course needed multiple surgeries and had a very long hospital stay. I saw him a few months later when he was admitted for another issue. He was down to 90 pounds, from about 150, and was getting fed through a peg tube. He was very lucky to be young and otherwise healthy, but obviously not very smart. I know a guy who went to the doctor in a panic thinking he had cancer because when he tugged his eyebrow hair some came loose. Oh crap, I think I have cancer. Not a doctor, work an ultrasound. Patient, we have been trying to get pregnant for 5 years with no success. Me, are you currently on any infertility drugs? Patient, no, but I have been on birth control for the last 7 years. Me, you are currently on birth control but also trying to get pregnant. Patient, yes, I like to know when my period is coming. Paramedic here, called for a diabetic. I get there and the patient is an older gentleman who is laying on a bed with what looks like a white mask on. I ask what's going on, and the family goes on to explain that he's a diabetic and the doc told them to give him frosting if his sugar gets low because the sugar content will perk him up. Turns out he didn't explain that they should put it in his mouth. That's right, they put a white frosting mask on this poor guy. Shocker, it didn't work. I have a few examples. Patient who recently been diagnosed with diabetes. We needed to adjust her blood sugar levels but she kept eating sweets. So we had a talk for like 30 minutes with her about not eating sweets and so on. She seemed to understand. 5 minutes after the conversation she went around drinking a soda. Another guy who had a benign arrhythmia, the heart beats irregularly. He knew that he could get the arrhythmia from time to time, but as long as he didn't faint or got any pain in the chest he could just take a beta blocker and let it pass. But he went to the ER like 6-7 times before he understood that we couldn't do anything. One patient came in for something, can't remember what, and when we ran tests we found that he had a pH of 6.97. That is on the border of what the body can have and still have any function at all. Read, he should be dead, but he was awake and clear. We wanted to admit him to the ICU and adjust it with utmost care, but he needed to go home to eat a shrimp sandwich. Yes, a shrimp sandwich. We sat down and talked to him and his mother for 30 minutes that no shrimp sandwich in the world is worth your life, and if there is something else you need to get help with we can help him. But nope, he left. He came back a couple of hours later and we cured his acidosis, but that must have been a mean shrimp sandwich. I wish someone loved me as much as that guy loved his shrimp sandwich. Nad, however, recently talked to a patient that is getting ready for surgery that involves usage of robotic arms to help remove the tumors, allows for smaller incisions and greater precision. This patient starts insisting to meet the doctor when it seemed like the consult was wrapped up, so we get him back in there, thinking maybe she's got another question. The patient says, I still want to meet the doctor, and the doctor points at himself and says, I'm the doctor. Patient, I know you're a doctor but I want to meet the doctor. Doctor, you've already met the resident. I'm the doctor doing your procedure. Patient, no, not you. I want to meet the robot that's going to do my surgery. I feel like we should at least shake hands first. Apparently the patient was expecting some metal man to walk through the door. The patient also had cancer cure recipes and was insistent we take notes. Student here. A guy came into the ER one time because he noticed dandruff. Dandruff? Like, have you not heard of Head and Shoulders? He might have only heard about knees and toes. I'm a dental nurse. My favorite was a 30-something-year-old woman who came in for a checkup at the emergency low-cost clinic I worked at. Teeth were broken and almost black and gums are angry swollen. Bright red and bleeding by just moving her tongue against them. Needed multiple scaling hygienist appointments and a debridement. Honestly, YouTube has some amazingly disgusting videos of this treatment, but maybe keep the sound off if you don't like the scraping sound. X-ray showed she had all but her wisdom teeth and 10 fillings. Root canals to try and save some teeth and extractions for I think 3 but more if the RCT didn't work. Explained everything and did the usual explanation of proper oral hygiene. Asked her if she had any questions, to which she says, it's okay if I lose this set of teeth, my others will come through. Me and the dentist just looked at each other probably a lot longer than we should have. No words. I couldn't think of anything to reply to that comment. I had a lot of weird and disgusting things happen at that clinic. I actually miss working there. When I was a child, my uncle told me if you live long enough you'll get a third set of teeth. It took me a long time to realize he meant dentures. I was asked by a patient on the respiratory ward if I thought his lung cancer might have had anything to do with his 50-a-day smoking habit, because he smoked roll-ups, and he wasn't sure if they counted. I struggled to keep a straight face and said yes, and busied myself in his chart. I had a patient convinced that he was safe from asbestos cause he smoked a lot and it coats his lungs. I mean, you're right but you're wrong. My wife is an RN who works at an outpatient surgery center. Cataract surgery is one of the common surgeries that they do. Patients are told that after the surgery, they should put eye drops in 4 times a day for 1 week, so 28 drops altogether. One patient asked if it would be okay to just put the 28 drops in all at once so they didn't have to deal with it for a week. Maybe the guy who had previously had an anaphylactic reaction to a foodstuff, but wasn't sure he was really allergic so thought he'd test it out by bringing some to the ED waiting room and eating it. Spoiler, he was really allergic. I mean, if he's going to test it he did so in the best possible place. Respiratory therapist here was working and was told we were getting a patient in respiratory distress. When she gets in she is having problems breathing and need oxygen. I'm placing an oxygen mask on her and she yells I'm allergic to oxygen. I heard the doctor laugh behind the curtains. My mum works in hospital and the techs from radiology always have the best stories. Last week they had a male patient with a huge carrot up his ass. He came from a conservative area. By bus, standing cause could not sit. If I ever could change my job I wanna be a radiology tech. 2 patients brought in a jar of water with string in it as proof they had worms. My one patient used to hold in her farts to the point of being an antagonizing pain because she thought that there was a certain amount of air inside a person, and if you let too much out you'll deflate. I could stand to deflate a little. Oh frick, if we're talking stupid ED visits. A woman came in because she got stung by a bee. Not allergic and no reaction. It just hurt. A woman brought her kid in because he got stung by a bee. Not allergic and no reaction. An entire family came in because they found a dead mouse in their apartment. Woman came in for a 2nd-degree burn on her arm. That was roughly the size of a Tic Tac. A woman spent like 5 minutes explaining to me that because of all the vaccinations we give dogs we're seeing a rise in doggy autism. I like to call it portism. An entire family came in because they found a dead mouse in their apartment. They take the plague very seriously. Had a patient and his girlfriend complaining of fleas. They were covered in red spots that they were picking at constantly. They were heads that were picking their skin off and imagining bugs were crawling on them. They were adamant that they had seen these bugs and pulled them out of these sores. Discharge instructions. Stop doing M. We had a young methamphetamine addict present with upper abdominal pain. She had a gastroscopy and deteriorated afterwards. CT showed she had a perforated stomach following the procedure, the worst possible complication, and would need emergency surgery. Despite the damage she was not clinically too unwell, yet, despite hours of counseling pleading she self-discharged later that day to go home and smoke M. Never heard about her again. Work in ED. Called the ambulance for chest pain. Was just upset her husband went to the tab. Gambling. Without her. Father-daughter combo. Convinced they had chickenpox. They had been outside fishing in the evening around mangroves and were eaten alive by sandflies. Came in hunched over in pain and crying. Claiming abdo pain. Didn't like the flavor of his meat pie and wanted it out of his body. The old sunburn trick and forgot to put it on and they suffer sunstroke. Drinking last night and expect us to cure their hangovers. That chickenpox story reminds me of when I was a kid on vacation in Florida and came down with chickenpox. My grandmother had taken me to the playground for something to do and some man noticed the scabs and said boy she got bit up bad. My grandmother agreed and said I needed more bug spray next time. You've been visited by swining thick boy. Like and comment swing well thick boy and you'll be blessed with many thick woofers in your life. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video, or don't. Either way, have a great day you magnificent people.